Hey everyone! Welcome back to the channel. Today, we're diving into an important topic: bipolar disorder. We're going to explore what it is, how it affects mental health, and discuss some tips for managing your mental well-being to help reduce the risk of triggering mood swings or episodes. If you or someone you know is dealing with mental health challenges, remember, help is always available, and you're never alone. Let's get into it. What is bipolar disorder? So, what exactly is bipolar disorder? It's a mental health condition characterized by extreme mood swings that include emotional highs, called mania or hypomania, and lows, known as depression. People with bipolar disorder may experience intense energy, euphoria, and irritability during manic episodes, and deep sadness, hopelessness, or fatigue during depressive episodes. Types of bipolar disorder. There are actually a few different types of bipolar disorder. Bipolar I disorder, characterized by manic episodes that last at least 7 days, or by manic symptoms so severe that hospitalization is needed. Bipolar II disorder, defined by a pattern of depressive and hypomanic episodes, but without the full-blown manic episodes. Cyclothymic disorder, involves periods of hypomanic symptoms and periods of depressive symptoms lasting for at least 2 years, but less severe than bipolar I or II. What are the signs and symptoms of bipolar disorder? People with bipolar disorder experience periods of unusually intense emotion and changes in sleep patterns and activity levels, and engage in behaviors that are out of character for them, often without recognizing their likely harmful or undesirable effects. These distinct periods are called mood episodes. Mood episodes are very different from the person's usual moods and behaviors. During an episode, the symptoms last every day for most of the day. Episodes may also last for longer periods, such as several days or weeks. Symptoms of a manic episode: feeling very up, high, elated, or extremely irritable or touchy. Feeling jumpy or wired, more active than usual. Having a decreased need for sleep. Talking fast about a lot of different things, flight of ideas. Racing thoughts. Feeling able to do many things at once without getting tired. Having excessive appetite for food, drinking, sex, or other pleasurable activities. Feeling unusually important, talented, or powerful. Symptoms of a depressive episode: feeling very down or sad, or anxious. Feeling slowed down or restless. Having trouble falling asleep, waking up too early, or sleeping too much. Talking very slowly, feeling unable to find anything to say, or forgetting a lot. Having trouble concentrating or making decisions. Feeling unable to do even simple things. Having a lack of interest in almost all activities. Feeling hopeless or worthless, or thinking about death or suicide. Sometimes people have both manic and depressive symptoms in the same episode, and this is called an episode with mixed features. During an episode with mixed features, people may feel very sad, empty, or hopeless while at the same time feeling extremely energized. A person may have bipolar disorder even if their symptoms are less extreme. For example, some people with bipolar II disorder experience hypomania, a less severe form of mania. During a hypomanic episode, a person may feel very good, be able to get things done, and keep up with day-to-day life. The person may not feel that anything is wrong, but family and friends may recognize changes in mood or activity levels as possible symptoms of bipolar disorder. Without proper treatment, people with hypomania can develop severe mania or depression. Causes and triggers. The exact cause of bipolar disorder isn't fully understood, but it's believed to be a combination of genetics, brain structure, and environmental factors. While you can't prevent bipolar disorder if you're genetically predisposed, there are ways to manage mental health and minimize triggers for mood episodes. Some common triggers for mood swings include: stress, major life changes, trauma, or conflict can set off a mood episode. Lack of sleep, insomnia, or irregular sleep patterns can worsen symptoms. Substance abuse, drugs and alcohol can exacerbate manic or depressive episodes. Tips for avoiding mood triggers. Now, let's talk about some healthy lifestyle practices that can help avoid triggering bipolar episodes or maintain overall mental health. Stick to a routine. Keeping a regular daily schedule helps regulate your mood and energy levels. This includes maintaining a consistent sleep schedule, which is crucial. Stay active. Exercise releases endorphins, which can improve mood and reduce stress. Aim for at least 30 minutes of physical activity a day. Eat a balanced diet. Healthy foods, like fruits, vegetables, whole grains, and lean proteins, provide your brain with the nutrients it needs to function properly. Practice stress management techniques, whether it's through meditation, yoga, journaling, or deep breathing exercises. Finding ways to manage stress can help avoid emotional overload. Limit substance use. Avoid excessive alcohol consumption and refrain from drug use, as these can destabilize mood and interfere with medication or other treatments. Build a support network. Having friends, family, or a therapist you can talk to helps when you're feeling overwhelmed or uncertain. Social support is a key factor in managing mental health. It's so important to recognize that professional help is key to managing bipolar disorder. If you or someone you know is experiencing symptoms, it's essential to consult a mental health professional. Therapy, medication, or a combination of both may be necessary to treat the condition effectively. Remember, mental health is just as important as physical health. Taking care of yourself and reaching out for help when needed are signs of strength, not weakness. If you found this video helpful, be sure to give it a thumbs up and subscribe to the channel for more mental health content. Let me know in the comments if you have any questions or topics you'd like me to cover next. Stay safe and take care of your mind.